The work we do at the Taala Foundation really revolves around advocating for the highest attainable standard of mental health care and well-being for gender and sexual diverse youth in the country. How have we been able to do this? Mental health promotion, prevention of illnesses, and treatment of illnesses when they occur, mental illnesses that is. Competent mental health care providers vis-a-vis the need is very low. When it comes to LGBT people, every conversation I had with an LGBT person had pain in it. The need came from feeling all of this pain and empathizing with the need for change. We do a lot of research around mental health, so every time we have a mental health intervention, we try to collect data so that we can have a research bank or an evidence-based for strategic litigation or just for research purposes or just building an evidence base. The change is already happening. There's so many institutions that are working in favor of the promotion of health and rights of LGBT people. Mental health is also largely misunderstood and underfunded generally. And so entering this field, I knew that getting mental health support specifically for marginalized population is going to be difficult. But that difficulty is what showed me that it's important, it's necessary. Let LGBT people be free and let healthcare be accessible to everyone.
We provide pro bono aid, which is ideally free aid, legal aid. We have women and girls who can access our offices in Kampala and just walk in any day and speak to a lawyer. Mental health and well-being and welfare and self-care for the lawyer is important. It's something we even budget for and advocate for with our partners and donors that support our work. I know so many women, after speaking to a lawyer and telling them, I am done with this marriage, my daughter has disappeared, or my child was trafficked. They want someone to believe them. What I am going through is not just a concern because I am a mother or a wife, or I'm someone going through divorce, I am losing my children in a custody battle. But my pain can be translated into a legal demand. Growing up, I wanted justice. But my mom was merely a primary school teacher, and the only thing that always kept her in the marriage is that so her daughters could get an education. But when I see a poor woman who can't afford a lawyer, because I know my mom needed a lawyer on so many occasions. So when I see these women coming out, I tell my colleagues every day that I see my mother walking to our office every day, saying my child has been taken to Saudi Arabia and I want Prima to come back. Every day I see that, and I have to stand with that woman and say, Prima has to come back.